Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a crucial topic that affects millions. Reproductive health, impacts on fertility. This is part 91 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Have you ever wondered how metabolic health can affect fertility? Today we'll be diving into the intricate relationship between reproductive health and insulin resistance. Now, insulin resistance is a condition where the body's cells don't respond effectively to insulin, leading to elevated blood sugar levels. Beyond simply raising blood sugar, insulin resistance can impact a multitude of bodily systems, including, significantly, the reproductive system. The effects of insulin resistance on reproductive health can be wide-ranging, from hormonal imbalances to polycystic ovary syndrome, known as PCOS, and even impacting the quality of sperm. Understanding these connections is key whether you're actively trying to conceive, planning for the future, or just interested in maintaining overall health. Now that we understand the basics, let's delve into how insulin resistance can impact fertility and explore some practical solutions for managing and preventing these potential complications. One of the common conditions associated with insulin resistance is polycystic ovary syndrome, or PCOS. This hormonal disorder affects 1 in 10 women of childbearing age and is a leading cause of infertility. In women with PCOS, the ovaries produce higher than normal amounts of androgens, or male hormones, which can interfere with egg development and release. Now, you might be wondering, how does insulin resistance fit into this picture? Well, high levels of insulin can stimulate the ovaries to produce more androgens. Over time, this can lead to the formation of small, fluid-filled sacs in the ovaries, known as cysts, hence the name polycystic ovary syndrome. These cysts can further interfere with ovulation, making it difficult for women with PCOS to conceive. But here's the good news. Managing insulin resistance can significantly improve the symptoms of PCOS and boost fertility. This is often achieved through a combination of lifestyle changes and medication. A diet rich in whole foods, regular physical activity, and maintaining a healthy weight can all enhance insulin sensitivity and help regulate menstrual cycles. Medications like metformin can also be used to improve insulin sensitivity. In some cases, hormonal treatments may be recommended to restore a normal hormonal balance and stimulate ovulation. Let's look at a real-life example. Meet Sarah. She's 32 and has been struggling to conceive due to her PCOS. After adopting a low-glycemic diet and a regular exercise routine, combined with metformin treatment, she saw a regularization of her menstrual cycles within 6 months. And the best part? She successfully conceived within a year. So, managing insulin resistance can help in controlling PCOS and improving fertility. It's a clear example of how understanding and addressing metabolic health can have a profound impact on reproductive health. Remember, every step you take towards better metabolic health is a step towards a healthier, happier you. Insulin resistance doesn't only impact women, it can also affect men's fertility. This metabolic condition can have a significant influence on sperm production and quality. The underlying reason is that insulin resistance can lead to changes in hormone levels, which in turn can affect the process of sperm production, also known as spermatogenesis. When insulin resistance occurs, the pancreas produces more insulin to compensate for the reduced effectiveness of insulin in the body. This excess insulin can disrupt the balance of hormones, including testosterone, which plays a vital role in sperm production. An imbalance in testosterone levels can result in reduced sperm count, decreased sperm motility, and changes in sperm morphology, all of which can affect a man's fertility. Managing insulin resistance to improve sperm quality involves a multifaceted approach. The first step is lifestyle changes, such as adopting a balanced diet, rich in lean proteins, whole grains, and fruits and vegetables, and engaging in regular physical activity. These changes can help improve insulin sensitivity, balance hormone levels, and ultimately enhance sperm quality. In addition to lifestyle modifications, antioxidant supplements may be beneficial. Oxidative stress, which is often increased in individuals with insulin resistance, can damage sperm cells. Antioxidants such as vitamin C, vitamin E, and selenium can help combat this oxidative stress, protecting sperm cells and potentially improving sperm parameters. Let's consider a real-life example to illustrate this. John, a 35-year-old man, was experiencing issues with low sperm count and motility, which were linked to his insulin resistance. John decided to take action, adopting a balanced Mediterranean diet, engaging in regular exercise, and taking antioxidant supplements. After 4 months, his sperm parameters improved by 50%. This example highlights how managing insulin resistance can positively impact sperm quality and potentially improve fertility. In conclusion, insulin resistance can indeed affect men's fertility, specifically sperm quality. However, it's important to remember that effective management strategies are available. By improving insulin sensitivity through lifestyle changes and potentially incorporating antioxidant supplements, men can have a positive impact on their sperm parameters. The effects of insulin resistance can extend to hormonal imbalances that affect fertility. Hormones play an intricate role in our reproductive health, and when they're out of balance, it can cause a ripple effect on our fertility. Insulin resistance can be a major disruptor in this delicate hormonal dance. When our bodies become resistant to insulin, it often leads to elevated levels of insulin in the bloodstream. These high insulin levels can have a domino effect on other hormones, particularly those related to reproduction. For women, insulin resistance can lead to increased production of androgens or male hormones, which can disrupt the menstrual cycle and ovulation, leading to difficulties in conceiving. For men, insulin resistance can lead to hormonal imbalances that affect the quality and production of sperm. So, how can we manage these hormonal imbalances due to insulin resistance? A balanced nutrition is key. Consuming a diet rich in lean proteins, healthy fats, and low glycemic carbohydrates can help regulate blood sugar levels, thus improving insulin sensitivity. Regular physical activity can also help manage insulin levels, as exercise increases the body's sensitivity to insulin, helping it to work more effectively. Stress reduction techniques such as yoga, meditation, or even just taking time for self-care can also be beneficial. High stress levels can exacerbate hormonal imbalances, so finding ways to manage stress can be a critical part of the puzzle. In some cases, herbal supplements under medical supervision can also help to balance hormones. Always consult with a healthcare provider before starting any new supplement regime. Let's consider Lisa, a 28-year-old woman who experienced irregular periods and difficulty conceiving. By focusing on balancing her blood sugar through a healthy diet and incorporating yoga for stress reduction, she saw a normalization of her cycles within 3 months. These changes didn't just improve her chances of conceiving, but also enhanced her overall well-being. In conclusion, insulin resistance can disrupt the delicate balance of reproductive hormones, posing challenges to fertility. However, with the right strategies in place, these hormonal imbalances can be managed. Balancing blood sugar can lead to improved hormonal health and fertility. Obesity, often linked with insulin resistance, can also impair fertility. Obesity affects the body in various ways, and when it comes to fertility, the impact is significant. For women, obesity can disrupt normal ovulation and menstrual cycles, making conception more difficult. In men, obesity can affect sperm production and quality, potentially leading to lower fertility rates. But here's the good news. By managing obesity, we can also manage insulin resistance and improve fertility. The key is a gradual, sustainable approach to weight loss. This isn't about crash diets or punishing exercise regimens, it's about making long-term lifestyle changes that not only improve fertility, but also overall health and well-being. A nutrient-dense whole foods diet is a great place to start. Foods that are high in fiber, lean protein, and healthy fats can help manage blood sugar levels and promote weight loss. Regular physical activity is also crucial. This doesn't necessarily mean hitting the gym for hours every day. Even moderate activities like walking, swimming, or cycling can make a significant difference. Let's take a look at a real-life example. Meet Mike and Emma, both 38. They were struggling with infertility and both were dealing with obesity. They decided to work together to make lifestyle changes. They started eating a whole foods diet, reducing their intake of processed foods, and they began a regular exercise routine. Over 6 months, Mike lost 40 pounds and Emma lost 30 pounds. They didn't just see improvements in their physical appearance. Their reproductive health markers also improved and they were able to conceive naturally. This story is not unique. Many couples and individuals around the world have seen similar improvements in their fertility after addressing obesity and insulin resistance. It's a testament to the power of lifestyle changes and the interconnectedness of our bodily systems. To conclude, obesity and insulin resistance can present challenges to fertility, but they're not insurmountable. With the right strategies in place, it's entirely possible to improve reproductive health and increase the chances of conception. Remember, a healthy weight can significantly improve reproductive health and fertility. Insulin resistance can also lead to complications during pregnancy, such as gestational diabetes. This condition, which only occurs during pregnancy, can lead to high blood sugar levels and potentially result in complications for both the mother and the baby. Women with insulin resistance are at a higher risk of developing gestational diabetes due to their body's inability to use insulin effectively. But fear not, there are several strategies to manage this risk. First and foremost, optimizing health before conception is key. This includes adopting a balanced, nutrient-rich diet, regular physical activity, and maintaining a healthy weight. Medical supervision is also crucial during this time, as regular checkups can help monitor blood sugar levels and adjust treatment plans as necessary. In some cases, medications may be needed to maintain optimal blood sugar levels. Always remember, the healthier the mother, the healthier the pregnancy. Optimizing health before conception can help manage the risk of gestational diabetes. So we see how closely fertility is linked to metabolic health and insulin resistance. The key takeaway from our discussion is that insulin resistance can significantly impact fertility, affecting both men and women in different ways. From polycystic ovary syndrome to hormonal imbalances, sperm quality, obesity, and even gestational diabetes, the ripple effects of insulin resistance are far-reaching. But there's hope. By implementing lifestyle changes, utilizing medications and supplements, and seeking medical advice, these impacts can be managed and, in some cases, reversed. Remember, the journey to improved fertility isn't a sprint, it's a marathon. It takes patience, effort, and consistency. You're not alone in this journey. There are countless others who have walked this path and found success, and there are numerous resources available to help you navigate your way. Stay tuned for our next video where we'll continue to explore this important topic. Until then, remember, your health is in your hands. Remember, reproductive health is a complex interplay of various factors, and addressing insulin resistance is just one piece of the puzzle. However, by improving your metabolic health, you're creating a strong foundation for fertility and overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their fertility journey. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decisions, especially those related to fertility and pregnancy, should be discussed with a licensed physician or qualified healthcare professional.